Hello, dear students. Today we begin a new topic, namely abnormal psychology, or if you prefer, psychopathology, or if you prefer, mental illness. All these terms mean about the same thing. In daily life, many a person may present some behavior or some attitudes or perceptions that at first may appear to be abnormal, but for it to rise to the level of being diagnosable, which is to say, true abnormality or psychopathology, some certain standards are going to have to be met. And the text that's used goes by the initials DSM because the name of the book is so doggone long that nobody wants to say it. It is an abbreviation for the Diagnostic and Statistical Manual of Mental Disorders, currently out in the 5th edition. And so as we start to get specific now, for something to rise to the level of a psychological disorder, which is oftentimes the phrase that psychologists would prefer, there's going to have to be severe distress, some real disability, or some life dysfunction at home, work, or school for something to rise to the level of being diagnosable. And incidentally, all the mental health professions, and there's more than one of them, use the same diagnostic manual or decision base for deciding what, if any, diagnosis should be made. There's an old saying that says you can't tell a book by its cover, but if you will pardon a little bad humor, well, what the heck? Yes, indeed, this is the cover of the Diagnostic and Statistical Manual. Stop by the library sometime. There may be a copy there waiting for you to glance through it. And so once again then, this is the book that has all the possible diagnoses in it, and if you are thinking of perhaps joining one of the mental health professions, you'll be looking at this book a lot while you are in training or practicing. I think you're going to be surprised to learn that mental disorders are fairly widespread. However, just because they are widespread, that does not make all of them severe. Everybody who gets physically ill doesn't go to the doctor. If you have cancer or pneumonia, I sure hope you go. If you have a cold, are you sick? Yes, but most people don't go to the doctor because they have a cold. As you can see, about 1 person in 4, if they would happen to visit a mental health professional with a complaint, would actually get a diagnosis. But once again, some of the disorders are not as severe as others, and oftentimes people just choose to do nothing and perhaps suffer, which is a shame. The most frequently occurring disorders are the anxiety disorders, nearly 20% as you can see. Schizophrenia is fairly widespread, 1%. Now, schizophrenia, unlike many other disorders, is pretty much a lifetime disorder. We'll spend a lot of time on that in a later lecture. In a country like the US with 300 million people, move your decimal point 2 places and you come up with 3 million schizophrenics. Alcohol is the most widely abused drug in the United States. Why is it legal? Well, think about the Great Depression. We once made alcohol illegal. Did that keep people from drinking? Not. A little bit of unfairness here. More people in the lower socioeconomic status groups tend to be mentally ill. No, poverty will not make you mentally ill as such, but it is an additional stressor. And if the person is unlucky enough to have the genetic makeup to predispose them for a mental illness, then it becomes more likely to develop. However, mental illness occurs in all the economic groups. In fact, sometimes people leave a higher economic group and move into a lower status group because they become poor because of their mental illness. People who are mentally ill are sometimes stigmatized. That's a fancy word that means made fun of or mocked or looked down upon. In some cases, more than one mental illness is present at the same time. That's what comorbid means. Just like someone who has diabetes can also have a heart attack, that's not fair. People who are schizophrenic will sometimes, perhaps oftentimes, become profoundly depressed. And thinking about that term comorbid for another moment, at any one time about 6% of the population suffer from 3 or more disorders. Let's take a moment now and talk a little bit more about the the DSM, the big textbook used by all the mental health professionals. As you can see, it's published by the American Psychiatric Association, but it's actually written chapter by chapter by large committees of people from the entire variety of mental health professions out there. Laundry list of those coming up in just a few minutes. By the way, here's some disorders that you may have heard of in the past: ADHD, autism, major depression, bipolar disorder. I mentioned schizophrenia a little while ago. And here's the list of mental health professions as they're practiced in Texas. This is identical or nearly identical to the other American states. At the doctoral level, you have psychiatrists and psychologists, and as you likely know, psychiatrists typically have an MD degree, psychologists typically have a PhD degree. But you don't need to be Dr. So-and-so if you want to be formally recognized and formally licensed as a mental health professional. You could get a master's degree, which takes a good bit of time less. You could become a clinical social worker, perhaps by going to University of Houston or Texas A&M. You could become a licensed professional counselor by getting your master's degree in counseling or psychology or a related field. You could become a marriage and family therapist, getting your master's degree in that field, perhaps at University of Houston at Clear Lake. And last, and in some ways my personal favorite, you could get your associate's degree by no less a place than Houston Community College. You'd get your focus of training in the area of chemical abuse and drug abuse and become a licensed chemical dependency counselor. All of these professions use the DSM when it comes to making a diagnosis. There's some similarity in their trainings along the way, but some differences as well. As you likely know, only psychiatrists write prescriptions, the other fields don't. But interestingly enough, more psychiatric prescriptions are written by general practitioners, by gynecologists, nurse practitioners, physician's assistants than are written by psychiatrists. Oftentimes people would like to know, where do these mental illnesses come from? Looking at some sites on the internet, you can sometimes get very quick and easy answers, but quick and easy answers are most often the ones least trustworthy. So let's take a look at this big fancy label here. Most of the time, the model that's used to explain the cause of mental illness is the Biopsychosocial Model. That's an invented word. Look at the bio part and you come up with biological factors. Look at the psychological part and you come up with psychological factors. Look at the social part of the word and you come up with the environment in which a person is raised or is existing. Oftentimes on the internet and some other places, they want to tell you, oh, some one thing. It's biology, or it's what you're thinking, or it's your environment that's the cause. But in the real world, most of the time, it's some combination of these things. The interaction of these three factors, that's the cause of the mental illness. And if the treating professional can get in there and kick one of the legs out, that can bring about some improvement. But sometimes interventions are needed in 2 or perhaps even 3 areas in the case of a severe mental illness. Okay, guys and ladies, here's hoping that you found this introduction to abnormal psychology or mental illness or psychopathology, whichever of these 3 terms that you might happen to prefer, hoping you found it informative and educational. So take care now and have yourself a great psychology day.